Sarah, a vibrant 28-year-old, had been feeling unusually tired. She noticed a rash on her palms but dismissed it as an allergic reaction. Weeks later, the fatigue worsened and she developed flu-like symptoms. A visit to her doctor revealed a shocking diagnosis: syphilis. Sarah was devastated. She had no idea how she contracted it. Syphilis can lurk silently in the body for years, its symptoms easily mistaken for other conditions. Syphilis is a sexually transmitted infection, or STI, caused by a bacterium called Treponema pallidum. This bacterium is highly contagious and spreads through direct contact with a syphilis sore, known as a chancre. These sores can appear on the genitals, rectum, mouth, or other areas of sexual contact. The tricky thing about syphilis is that these sores can be painless and even go unnoticed. This makes it easy to unknowingly transmit the infection. You can also contract syphilis through contact with infected bodily fluids, although this is less common. It's important to remember that syphilis can't be spread through casual contact like hugging, sharing utensils, or using public restrooms. Understanding how syphilis is transmitted is the first step in protecting yourself. Knowledge is power, and in the case of syphilis, it can literally save your life. Syphilis progresses through several stages, each with its own set of symptoms. The first stage, primary syphilis, is marked by the appearance of a chancre. This sore is usually firm, round, and painless, making it easy to overlook. It typically appears within 3 weeks of infection and heals on its own within 3 to 6 weeks, even without treatment. However, don't be fooled by the healing chancre. This doesn't mean the infection is gone. Without treatment, syphilis progresses to the secondary stage, characterized by a rash, fever, sore throat, muscle aches, and fatigue. These symptoms can be mild and easily mistaken for other illnesses. If still left untreated, syphilis enters the latent stage, where it remains hidden in the body, causing no noticeable symptoms. This stage can last for years, even decades. However, the infection hasn't disappeared. It's silently damaging internal organs, potentially leading to severe complications in the late stage. Late-stage syphilis is a serious condition that can affect the heart, brain, nerves, eyes, and bones. It can lead to heart disease, blindness, paralysis, dementia, and even death. The good news is that these devastating consequences are entirely preventable with early detection and treatment. Taking charge of your health means being proactive. If you're sexually active, regular STI testing, including for syphilis, should be a non-negotiable part of your healthcare routine. Remember, early syphilis is often asymptomatic, so regular testing is crucial even if you feel fine. Ignoring your sexual health is like playing Russian roulette with your future. Don't wait for symptoms to appear. Take control, get tested, and protect yourself from the silent threat of syphilis. Protecting yourself and others. Prevention is key. The most effective way to prevent syphilis is to abstain from sexual contact. However, for those who are sexually active, there are several steps you can take to significantly reduce your risk of contracting syphilis. Condoms, when used correctly and consistently, provide a strong barrier against syphilis and other STIs. Remember, condoms must be used during all types of sexual contact, including vaginal, anal, and oral sex. It's also essential to choose condoms that are latex or polyurethane, as these materials effectively block the transmission of the syphilis bacterium. Limiting your number of sexual partners can also lower your risk of exposure. The fewer partners you have, the less likely you are to come into contact with someone who has syphilis. This is especially important if you're unsure about your partner's sexual history. Breaking the silence. Talking to your partner, seeking testing. Open and honest communication with your partner about sexual health is crucial. Talk about your sexual history, any past STIs, and your comfort levels with getting tested together. These conversations may not always be easy, but they are essential for building trust and protecting each other's health. Remember, getting tested is not a sign of mistrust. It's a sign of respect for yourself and your partner. It allows you to make informed decisions about your sexual health and take action to prevent the spread of STIs. If you're concerned about privacy, rest assured that STI testing is confidential. Your results are kept private and are not shared with anyone without your consent. Many clinics offer free or low-cost testing services, making it easier than ever to prioritize your sexual health. Treatment and cure, taking action for your health. Syphilis is completely curable with appropriate antibiotic treatment, especially in the early stages. The standard treatment is penicillin, a highly effective antibiotic. Penicillin may be given as a single injection or a series over several weeks. For those allergic to penicillin, alternatives like doxycycline or ceftriaxone are available. Complete the entire course of antibiotics as prescribed, even if symptoms disappear. This ensures the infection is fully eradicated. Early treatment prevents long-term complications. If you test positive, seek care immediately. Syphilis is curable. Taking action today safeguards your health for tomorrow. Reclaiming your health. You are not alone. Being diagnosed with syphilis can be a daunting experience, but it's essential to remember that you're not alone. Many resources and support systems are available to help you navigate this journey. Your doctor can provide medical guidance, answer your questions, and connect you with support groups or counseling services. Don't let fear or shame prevent you from seeking help. Taking charge of your health starts with a single step: getting informed and getting tested. By prioritizing your sexual health, you're not only protecting yourself, but also contributing to a healthier future for everyone. Remember, syphilis is treatable and early intervention is key. Knowledge is power, and by arming yourself with the facts, you can make informed decisions about your sexual health and live a long, healthy life. Remember, health is life. Take charge of your health. Like and subscribe to the Health and Disease Info Center for more life-changing content. Together, we can build a healthier, happier world.